Good evening, everyone. Can you please check and give us a thumbs up if the audio and video is fine?
Take my thumbs up first. Hi, sir. How are you?
I'm doing absolutely good, Dr. Ashwani. How are you?
I'm good, sir. You're looking great. Your hair is really
I'm
nice.
not better than you. Okay, so it's always a great pleasure to share this screen with you. A lot of students have joined us. Good morning. Morning ही होती है मेरी ना, because of the morning motivation session. Whenever I take the Zoom or YouTube session, it always starts with morning. Good evening, everyone. So let's wait for another 30 seconds for some of more students to join us. And before we start, I welcome all of you in this session, exclusively planned for the first year MBBS student who have just joined into the MBBS. And I'm sure that it's been now some time into the MBBS and you're seeing a different world altogether. And so the session is an extempore session. We have not really planned things too much. It's basically a heart-to-heart talk for all of you as a senior, as guide, so that we can basically tell you that what goes towards a medico's life. So I still remember that when I entered into medical college in Maulana Azhar Medical College, it was year 2001. And I'm quite sure that some of you were not even born at that time when I entered into the medical college. So the moment I saw the result that I got rank 9 and I entered into the Maulana Azhar Medical College, you are at cloud 9 and you are like that there is something that has happened to you that has not happened to anybody else in the world. But when you enter into the medical college, you realize that you are just one of them, and all the people who are there are those great brains with you. And when you entered and when you see these big subjects, anatomy, physiology, biochemistry, the real fear, if you think that entering into the MBBS was a difficult task, so I will say good morning. The life is waiting for you ahead. And I still remember my days. 1st August 2001, I entered into the medical college. Initially for 1 month, 1.5 months, it was fun, apart from the ragging. And December, we had our first prof, first stage of upper limb. And I failed that stage. And before I started, Dr. Ashwani, I think we have not spoken about this particular part, and I just want to share this with you. That December, our first stage was there, and I failed, and it was a very strange moment for me to see fail in front of your name. And when we check the result, when we ask from our friends, everybody is like, "Arey yaar, I am also fail. अरे मैं भी fail हूँ." तो पता चला out of 180 students, 178 failed the exam. There were only 2 students who passed the exam. So that was the actual thing that has happened. And then you realize that the life in a medical college is totally different in comparison to the other point. And out of these 3 subjects, I feel that the one of the most difficult subject is anatomy. And I'm very, very happy that I'm sitting with the most renowned faculty of anatomy. People call him a magician. But I will say that not just for the anatomy, he's a magician for everything. He has taught undergraduate student also some of the zoology and botany, and people called him magician there also. So, boss, first of all, welcome to this session. And tell me that how you make anatomy so simplified, and what is in you, so that people don't feel that stress of reading anatomy. One. The second is how the students who have entered into the medical college, they should handle this so-called the big fearful subject called anatomy. Over to you.
Well, sir, thank you so much. Well, just like you said, it's always a great pleasure to talk to you. आपके हमारे सेशन हमेशा ऐसे एक्सटेम्पोर होते हैं, एंड आई ऑलवेज एंजॉयड दीज सेशंस विद यू, वो चाहे यूजी के लिए हो पीजी के लिए. Well, directly addressing the question, sir, you said ki what I do to make this subject easy. Well, this I say sometime in my demos also ki whatever subject you're reading na, it's till the time you'll start anticipating. जब तक आप ये anticipate नहीं करोगे, what is the next thing, what you want to see. अगर आप dissection hall में जा रहे हैं, going blindly into the dissection hall, just कि हाँ आज कुछ पढ़ाएंगे and we'll see it there, you will never enjoy it here. Like एक example अगर मैं दूँ, like most of the people who are in first year probably upper limb हो चुका होगा, या they might be doing upper limb. So जब brachial plexus किया है, and I'm sure the moment you enter into the dissection hall and you just look at the dissected brachial space, brachial plexus, axilla, सबका दिमाग घूम जाता है. सबको लगता है कि यार what we saw in the class, वो जो nerves दिख रही थी and all that, and what we are seeing in the dissection hall, it's a two different world altogether. क्योंकि nobody is actually understood those concepts and entering the DH with a mindset कि हाँ मुझे आज वहाँ median nerve देखना है. I know something about this nerve and I need to find out कि okay musculocutaneous nerve कैसे pierce कर रहा है muscle को. So it's that कि हमारा regime ही कुछ ऐसा है कि we are so much book bounded, we are like reading whatever is given in the book, and I'm like, not only me, I know that people अभी आप first year students है, so they are not aware of radiology, but they will come to know कि probably most of the faculties that we have in our platform, that they try to make this subject conceptual. उसके पीछे का core क्या है, what is the concept behind it, they try to make them understand this, and that is what makes it interesting. As I said कि आपने ऐसा भी बोला कि it's a very big transition. The moment you come from +2 आप एकदम से MBBS में आते हैं, the subject that you're reading, first of all, though, that entire feeling that shed off, then you understand that you are no more that first rank of your, or the topper of your school or college, because everyone probably is just like you only, and you probably will face the failures also. So and it's a different world altogether, like whether it's anatomy, physiology, or biochemistry. Especially when you're reading the subject like anatomy, you need to understand the basics behind it, the general part about it here. It's a complete Greek and Latin language. The more you know about those terminologies, the more you understand them, the more you apply them, so it gets better and better here. जैसे आप हमेशा example देते हो, किसी language को सीखने के लिए पहले उसके alphabets आने चाहिए. So this is इतना इनिशियली इतना सब कुछ होता है कि कॉलेज के अंदर आए हैं, सीनियर का प्रेशर है, पढ़ना भी है, लाइक लाइफ भी एंजॉय करनी है, और साथ में एनाटॉमी सब्जेक्ट भी आ गया यहाँ पे. तो बाय द टाइम दैट फेज गेट्स ओवर ना, तो हम ऑलरेडी लेट हो चुके होते हैं. सो पूरे साल ना पीपल आर जस्ट कैचिंग अप ओनली. दैट्स हाउ इट इज.
Dr. Ashwani, I think everybody is very, very focused in the world nowadays. Yes, है ना? और the moment people enter into the medical college, they know now that ultimately they have to do a specialization. Yes, merely passing in MBBS will not help them, and unfortunately they have realized it after entering into the medical college. Yes. So let us talk to the point that how they should focus in preparing for a PG entrance exam also, simultaneously not missing the fun of life in MBBS, and as well as learning anatomy. Guys, just to introduce for those who do not know us, my name is Dr. Rajat Jain. I did my MBBS from Maulana Azad Medical College, followed which I did my MD in radio diagnosis from Maulana Azad Medical College. I got rank 9 during my PMT exam, and I got rank 1 when I appeared for the PG entrance exam, and I did my MD in radio diagnosis from Maulana Azad Medical College. And now I'm mentoring and teaching radiology students. It's been more than 1.5 decades of mentoring and teaching students radiology and guiding them how to sail through this boat. But just to tell you that during my MBBS, I was very, very active member of almost every activity in my college. I was very, very active in sports. I was the captain of cricket team of my batch. And I was very active in co-curricular activities also. And I still remember that in our fest, what is called as Synapse, I was the winner of Mehendi competition, where a guy was supposed to put the Mehendi onto the girl, and I was a winner of that. So I mean the whole, and I mean we have all gone through those wonderful trips during this. So it's not like that you have to be really a bookworm. I mean, I was lucky enough that I have got great seniors, I got great friends who have supported me. But I feel that in the world of technology nowadays, your medical knowledge is not limited to the medical college. I mean, there were during my time, probably there were few colleges which had a good support of seniors who used to mentor us, who used to guide us. But now, with the help of technology, with the help of motivated people who are available, they are there to support you. They are there to guide you, to mentor you, so that even if you are not amongst the so-called, I mean, all these are just names, these so-called top medical college, still you can reach, or you can live the life the way that you want and go on forward. I mean, that is how I have. And now, Dr. Ashwani, the next question that I want to ask you is that how the student can create a balance in learning the anatomy, having fun in the medical college also, plus simultaneously it will take care of their so-called that big word that is coming up, next exam. So you first talk about the anatomy, and then I will just give them an overview about the broad concept of next exam.
Well, sir, that goes without saying that and the subject anatomy is huge. I mean, it's not only for the first year, even where people who are preparing for the PG exam, once they are done with their all 4 years, they still believe that it's a very big subject and they kind of usually find it scary. The thing is that the less you will look at the amount of books or the number of books, and that we have like 4 volumes of gross anatomy, a volume of histology, and then embryology. Rather than if you'll just focus on that, there's without anatomy, like I'm just saying for the anatomy because I advocate the same for the physiology and biochemistry also. But like without this subject, there is no life ahead. You look like as we know that sir sitting with me, he's a radiologist here. Now, radiology is nothing without anatomy. Like if you can't identify a normal structure, then how can you identify a pathological structure in there? So the point is that you need to have a real motivation behind reading everything. When you read anything, you need to kind of correlate it clinically. Abhi to itne resources hain yaar. If you're reading something, let's say one example, if let's say you're reading a shoulder joint here, you can Google that what are the injuries of the shoulder joint, how the dislocation looks like. This kind of creates an interest in your head. Just coming out of that BDC, coming out of those core textbook from the pictures, you can always use YouTubes and all these different apps and resources available just to create that vibe in your head ki why am I reading this here? Brachial plexus पढ़ रहा हूँ तो Erb's palsy कैसा होता है, कैसा दिखता है, how a patient will look like. These resources are available everywhere. So the more you will motivate yourself toward the clinical world, the more you'll enjoy this preclinical part here. The preclinical part will look at times it will look boring. The only if you not correlate with the clinically to this here. And as this question is being like already काफी सारे questions आ रहे हैं इसके अंदर, that's being asked over and over again कि should I start preparing for the PG exam in the first year? Like I don't have any answer to this question. I would say that if you are doing your MBBS nicely, if you're just having a very very strong concept of pre and para clinical subject, like आपको कुछ अलग से करने की जरूरत ही नहीं है. Like I'm sure, sir, you didn't start preparing for your anything in your first year or second year. You were reading very well your subjects, and you were rank 1. What else we can expect from it?
Yeah, so I will simply say that if you know the subject well, I mean, this is more so true for the next exam. I mean, instead of rote learning, now the topic are become more of conceptualized. And during my MBBS life, I have always tried to learn the subject. I have always tried to go behind the why it is happening. And that is why I'm very, very proud to say that before being a topper of a PG entrance exam, I have got very, very sound knowledge of the subject, and I am a very good doctor. I am very, very proud to say on that particular part. In spite of being into the radiology, I mean, I still treat almost 10 to 15 patients a day, because the people feel more content when they get a stamp from me that yes, they are going or they are getting a right treatment from our side. So just to inform guys, see, if you are able to read on your own, if you are able to make your schedules on your own, if you can, books are the best friend. I mean, I always believe, I mean, anybody who can read it from the books, I mean, nothing can be better than that. But most of the time you need a guide. You need somebody who can make the content simplified for you. If you feel the need, I can tell you, I am not one person who just talk here and there, etc., etc. I'm a very, very straightforward, focused person in the life. We are there to support you, to mentor you, to guide you. For the first year, we are the only institute who has conceptualized videos, which are not just the PG entrance exam, which are the concept videos where the subject is taught in the way, what has been the way that should be taught to a first year MBBS student. We launched this last year and it has been appreciated by the students very, very well. All those who are who knows your second year, just talk to them and see the content that has been taught to them. And I'm very, very happy to tell you that now the anatomy will be taught to you by none other than Dr. Ashwani. Physiology will be taught to you by one of the legend in the physiology, Dr. Ashish. And one of the subject for which all of you are waiting, I'm seeing a lot of messages that the biochemistry will be taught to you by Dr. Smiley. So this is the best possible combination for the first year. Anatomy by Dr. Ashwani, physiology by Dr. Ashish, and biochemistry by Dr. Smiley. And I'm telling you, you cannot have this combination which will alleviate your fear of first year. I can tell you that it will be a cakewalk for you. Having said that, if you think that you can read the content on your own, you can read the entire BTC on your own, Snells on your own, nothing can be better than that. Creating your own schedules, reading at your own luxury is probably the best thing that can happen. But this happens with 2 to 5% of the people. A lot of time people ask us about the free and cost. I also want to say with very, very candid point, guys, there are no free lunches in the world. If something is available for a free, that means you are the product. A very wise man has said once, wealth is never created. It is just transferred. It is transferred from one person to another. Though we try, because there are costs involved in everything. I mean, you have to fill your own stomach first before taking care of the rest of the thing. It's a very, very standard. But we're going to try to make it in a way so that it is not financially a burden to you. Yes, there are people who can afford, there are people who cannot afford. We are there to support the people who cannot afford. We have already done a lot of scholarship programs, but there are people who can afford. They will have to pay a nominal charges for this. Yes, since you do not know it, don't believe on us. Fill this Google form that is available. And if you will fill this Google form, you will get a trial of the videos. You assess it yourself. You see how they are. And on the basis of that, you can subscribe to it. If you have already taken the trial previously, then unfortunately, we will not be able to give you the trial. However, if you have not taken a trial before, you fill the Google form and it will be made available to you. But in the concept video, I think Dr. Ashwani is going to talk more about it. Boss, can you please tell us more about the concept videos that are there in the Gurukul?
Yes, sir. The videos, as you rightly said, the videos were recorded purely keeping that first year student in mind. And as you rightly said that at most of the places, the apps which are provided to the students, they are the common app which are for the first year also and for the PG entrance as well. Now, fortunately, we got the opportunity last year to record the separate app. So I have a separate section which is called as a concept video, which is for first year. And then we have the videos for the PG student. The PG videos are like around for 60 hours. So that comprises of all the main topics which are asked in the PG entrance examination. And these concept videos are very elaborate. And that goes almost for 150 hours of teaching in there. So they're like the content obviously is very explicit and detailed. And every topic is discussed in a way that you should be able to mark the MCQs in it. You should be able to understand the clinical related to it. You should be able to answer the questions in your Prof exam. So because we have to cater everything, we are not only looking at, obviously we have to teach the concept, that's the first priority, but we need to also see that you have to pass a certain exam also in your first year, whether it's your sessional exam or your final exam, and then also to prepare you for the next and the NEET exam. So keeping that in mind, the videos are quite elaborate. And that's why, to answer that question, that if you compare the concept video and the videos, it's a difference of almost like 1:3. So if one is the PG videos, the 3 times we have the content in the, and we have separate sections for osteology, and all the bones with in hand are discussed. Histology is, and we have like separate section for everything. So that's quite elaborate when you look into
around 120 hours, right?
Yes, sir. 120 hours, and we have like adding even more content into it. The practical part we are including it in. So overall, it is going to go around like 150 hours in total.
And I feel, see, though the first year MBBS says that the anatomy, physiology, and biochemistry have equal weightage, but I feel that the single most important subject that is important in the first year MBBS is anatomy. The reason behind that is anatomy is linked with every other subject in the specialty. You will be reading surgery, you need anatomy. You will be reading orthopedics, you need anatomy. You will be reading ENT, you need anatomy. You will be reading ophthalmology, you need anatomy. You will be reading pediatrics, you need anatomy. You will be reading radiology, you need anatomy. Any clinical subject you're gonna read, if you do not know anatomy, probably you will not be able to move forward in that particular subject. I am not undermining the importance of physiology and biochemistry over here, but I am probably trying to give more importance to the anatomy over here. Physiology is also equally important for your medicine. I mean, there obviously, if you do not know physiology, and that is why the first year is forming the foundation. So if your understanding of first year subject is correct, I am telling you, the life will be a lot simple. Now, in the Gurukul, in the concept videos, what we have tried is we have tried to give you the weekly test in a way so that you remain on a structured schedule and you are able to finish your courses in a small time, what we call as a Pomodoro technique, to break down into small pieces so that you are able to finish that task. You are able to check or assess yourself with the help of a test, and simultaneously which keeps a track on your next pattern also, as well as the subject, and getting the decent score in your first year MBBS, because all these things also matter. I mean, it's not like just, I mean, the small happiness that you get in MBBS, topping in your stage, topping in your first year, getting a gold medal, though in a long run it does not matter, but all these small moments of happiness also motivates you to read better in future. Bache, for all those, so DBMCI has two platforms: the face-to-face classes and eGurukul, which is an app. The link, there is already a post that has already been pinned. You fill this Google form, you will be directed to the app, and you can download the app. Otherwise, you can go to the Play Store, you can go to the App Store, and you just get the eGurukul by DBMCI, and you can download this. If you will fill the Google form, you will get the complimentary access for some days, and you can assess the videos, you can assess the quality of the lecture. There are a lot of free videos which are already available on our YouTube channel on which you are watching this. You just type and scroll it, you will be able to see some of those videos, and I'm very sure that they're going to be very helpful for you. Meanwhile, if you have any doubts, anything, please remember, if you are a first year MBBS, you have to go for a concept videos.
Yes.
Please do not go with the PG plan. We are the only platform which has a separate PG plan as well as concept videos. Most of the people do not differentiate them. They feel ki chalo ji, PG videos are, that's all. No, that is not the way that the things work. The way that the first year student reads anatomy versus the final year student read anatomy is totally different. The way the first year reads pathology is, a second year reads pathology is totally different. The way a final year student reads pathology. So go for a concept video if you are a first year MBBS student. Dr. Ashwani, do you have anything to add to this?
I was saying that this is the reason actually these free videos are made available to you, because we really need to keep it very transparent. I know that you have wonderful teachers and professors in your college, and they're teaching you, they're doing a great job. But we really want you to attend the lecture in your college, do attend these classes in these the app which we have recorded, and see if we are able to serve you something extra. If you feel that we are able to like build a concept for you, if you feel that I can make something a little easier for you, then obviously it's worth going for it. That's why these videos are made available to you free. So what I recommend you is that whatever lectures are going on in your college, try to attend the same class through these videos here, rather than trying to covering up your backlog or something. You'll get a good perspective, you'll get a good correlation here. Again, we are not comparing anything, but if we are able to serve you something better, then only you should go for it and purchase the app. Otherwise, you don't have to. Like, obviously, sitting at this platform, we obviously will not advocate or will push this down your throat. It's entirely your choice.
Anonymous, if you have already purchased Batch', you need not to do anything. Now you have to just watch the videos. I still remember I was reading a comment a few days back. One of the student has wrote me, Dr. Ashwani, I just want to share it with you. So nowadays NEET PG, today is the last date of filling the form of NEET PG exam. So one of the student has filled the form, and then after filling the form, the final window came. Thank you for submitting the form. Your application has well received. So the student has written that this is the message. What do I need to do next? So lot of students have commented कि बच्चे अब इसके बाद पढ़ना है और प्रे करना है कि अच्छी रैंक आ जाए. So that is the same point that I want to say. कि now बच्चे, if you have already purchased the course, that now actually the real job begins. And the real job begins is you have to watch the lecture and you have to write the test. Please remember, merely purchasing is not gonna help. You have to watch it also, and then you have to check it.
We have our favorite Dr. Praveen here.
Dr. Praveen, students are asking, are there concept videos for the second year MBBS also? Do you want me to answer or you will answer this?
He himself will answer in the comment message only.
So for the second year, we have Dr. Praveen Kumar Gupta, who is the finest of the faculty of the pathology, who will be teaching concept videos again, which are different from your PG videos. Pharmacology will be taught by Dr. Saurabh Bhatia. Microbiology will be taught by none other than, again, the finest of the faculty, Dr. Nasir. And now there are 3 subjects. In older time, there were 4 subjects. So these 3 subjects of the second year will again be available, different from your PG videos, which will be more detailed, in-depth topics.
Sir, I want to answer these 2 questions in there. Shivam is asking that whether to buy all books or is it sufficient to study from lectures. Do buy your books here. No matter how much content we teach you here in the app or whichever platform you're using, and I'm pretty sure that sir will also agree with me on this, that do buy your books. You cannot just separate or you cannot just divorce your book completely and you can completely rely on the lectures. These lectures are to make your life.
I have a point here, and that is what I always say to the students, that see, this is the biggest difference that technology has done over a period of time. During our time, what used to happen is our senior used to tell us कि देखो anatomy में बीडी चौरसिया पढ़नी है, फिर उसके बाद ये टॉपिक ना स्नेल से पढ़ना है, इस टॉपिक को थोड़ा ग्रेस से देखना पड़ेगा. मुझको क्या लगता है कि the one big thing, one big help that we are able to do for the students is कि बीडी चौरसिया तो लेनी पड़ेगी, बीडी चौरसिया अभी भी पढ़नी पड़ेगी, स्नेल्स और ग्रेज पढ़ने की जरूरत नहीं है, उसका जो एडेड सिंप्लीफाइड कंटेंट है वो हम अपने आप आपको दे देंगे. यानी कि बेसिकली व्हाट आई ऑलवेज टेल इट टू द स्टूडेंट्स, सी पढ़ना तो आपको ही पड़ेगा बच्चे. What are we doing is we are providing you a support. There is a river. You want to cross the river. Obviously, you can swim across the river. We serve as a boat which tries so that you can easily get across that particular river. So, यानी कि अभी भी एक बेसिक स्टैंडर्ड बुक आपको लेनी है, उसको पढ़ना भी है, बट उसको पढ़ना आसान हो जाएगा. It will be easier for you to read that book. लॉट ऑफ टाइम क्या होता है, बुक पढ़ते हो, समझ ही नहीं आता, आप अपने दोस्त से पूछते हो, वो आपको समझाता है, आपको तो अच्छा वो ऐसे होता है. द सेम थिंग यू हैव डन in your 11th or 12th also. So that is the same thing that is gonna happen. Dr. Ashwani, if you want to add, just let me know.
Well, Prateek, thank you for your message. Prateek Nayak from AIMS, he said he gave the first Prof of ANAT and whatever was taught came in the exam and he was very happy. And thank you so much. Well, we are expecting like loads of distinction this time as well. Well, my dear Anonymous, one request to you, please don't spam the group. We got your question. इसको बार बार ऐसे स्पैम नहीं करो. देखो, that same thing the Pratik is also saying. Osteology, आपने इसका मतलब भी वीडियो देखी नहीं है. Osteology is done in detail. Osteology that you watched are also done by another professor, are done with in a close shot with the bones in hand. वो एक अलग section है आपका. I have also discussed also osteology. मेरी osteology तो वैसे ही freely available YouTube पे. So if you have not watched it, so osteology है उसके अंदर. और even if you still want, as Saran हम discuss भी कर रहे थे इससे आपसे पहले, if there is anything that you want me to discuss live also, so we can also arrange the lecture for that. If you find something difficult, आपको लगता है कोई चीज नहीं समझ में आई, even in the app or even if it is taught by someone else, we can definitely arrange the live lectures for you on the YouTube as well as YouTube Premium or in the app itself. बाकी उसके बारे में sir will tell you more in detail.
अच्छा, अपने नोट्स खुद बनाना ये बेस्ट होता है, इसमें तो कोई डाउट ही नहीं है. ठीक है ना, मतलब नथिंग कैन बी बेटर, बिकॉज उसकी जो रिटेंशन पावर है, जब आप रिवाइज करोगे ना तब आपको उसकी वैल्यू रियलाइज होगी. ऐसा नहीं है कि आपको सब कुछ याद आ जाएगा, तब भी सब कुछ याद नहीं आएगा. लेट मी टेल यू, even if your own notes, if you will open it after a few years or after a few months also for that matter, उसमें से काफी चीजें आप भूल चुके होंगे, बट उसको रिटेन करना, उसको दोबारा रिकॉल करना is much easier, है ना. That is how it is. Boss, I am expecting a big tough competition in the anatomy in this year, because last year was the first time when the anatomy subjects have been introduced by us. Student came to know about the concept videos much later. And even after that, I am happy to inform you. In fact, I'm sure that you are aware of that. 34,000 students have read from the concept videos last year. And this year, there is a big craze of the concept videos among the students. Dr. Nachiket has spoken to a lot of first years. I mean, he has visited a lot of medical colleges. And till now, we have almost 28,000 students who have already subscribed to the concept videos. But we want the concept video should reach to each and every MBBS student, so that their medical knowledge is not limited to their medical college. If anybody wants to read from them, they should be able to reach to that. So that is how broadly we have identified it. Over to you, Dr. Ashwani.
Let me just also address this one question which is coming again. Sir, I am a first year BPT student. Anatomy remains the same. You can definitely read it from there. Though I believe that the area that you'll be focusing more is the limbs part. So you can kind of watch it a little selectively in that ways. But yes, definitely those videos are like, I'm sure useful for you as well. Okay.
Dr. Ashwani, how to handle the stress of anatomy in the MBBS?
No stress nahi hai, sir. The stress is like all the stresses that we only created in our head. Now, who knows better than you? There is no stress. It's just that people, the moment, the day you'll start enjoying, this every single day in your medical college, then obviously the stress level will automatically go down. वो stress हमने खुद बनाया हुआ है इतना. So,
I mean, one thing that I want to say to everybody is, guys, please enjoy your medical college.
Exactly.
This time will never come back. Take my words on this. But you have to keep a balance. Problem क्या होती है, बच्चे ना स्क्यू हो जाते हैं, या तो पूरे इस तरफ या पूरे इस तरफ. कभी कभार मैंने देखा इतने मोटिवेट हो जाएंगे, सर आज से मैं सब कुछ छोड़ रहा हूं, अब मैं सिर्फ पढ़ रहा हूं. ऐसे में क्या होगा, you will read for 5 days and after 5th day you will stop reading. So you have to create that balance. Enjoy the life also. Make a good social circle. I mean, Dr. Ashwani बोल रहे हैं वाली बात, बट मैं बता रहा हूँ, स्ट्रेस होगा, कोई डाउट ही नहीं है. ठीक है, बट अगर आपके पास एक अच्छा सोशल सर्कल है, if you have caring friends with you, maybe girlfriend or boyfriend, then that's a very big support. I was lucky enough that I had a support from first year MBBS. But the point that I want to raise over here is that a complete support के साथ, a good friends, I mean, the friends that I have made in the first year MBBS, it's been more than 22 years now, and we are still amongst the best friends. So, I mean, create that kind of friends, create that kind of social atmosphere, कि automatically that stress goes for a toss. And try to learn the subject. Don't try to be in a rat race of the exam at this stage. Try to learn the subject with an ease and be regular with your studies. The more regular you will be with your studies, I am telling you, the better it will be for you. I mean, the stress level will be less.
Okay. Sir, there's a question asked by Mohit. He said, do we have to solve MCQ from the multiple sources or only the question bank of eGurukul? Well, my dear, till last year the story was a little different, but this year I can proudly advocate this thing that do solve the questions from DBMCI eGurukul, because we are filtering question. And when I say we are, that anatomy question will be taken care by me self, every single question, and keeping that in mind that you people will be giving a next exam. So that kind of clinical question exposure will be giving to you. So I can proudly say that you should stick to the eGurukul question bank if you are following our lectures, and that I'm sure that will be more than sufficient. Once you're done with that source, you can go beyond that if you want. But if you ask me that what to choose in between the two, definitely the eGurukul question bank, because this is not only me, but the entire 19 subject faculty this time is dedicated, and they are like taking care of the question bank in detail, and the entire question bank is refiltered and reframed.
शिवम, बच्चे MBBS के बाद पक्का नौकरी मिलेगी, मैं गारंटी देता हूं तुमको कि मैं ही दे दूंगा. I have almost, if not more, around 500 doctors who help me in managing my NGO, which is Doctors for You. And we do pay them a pretty decent amount. But the only part is that they have to work in difficult to reach areas. I mean, they have to work in rural areas. I mean, because those are the areas which are most needy. And I mean, if you want to live in a city, if you want to live in a metro city, there is so much competition that you have to do specializations. So that's a challenge. But yes, if you want to do MBBS and you want to serve the society, and not just as a charity, with a decent amount of money, dial me a number and I'll take care of you.
But sir, we'll ask this question when he's in final year or doing the internship, because the things and the mentality change every couple of months only. This is probably a very first year kind of query itself.
Yeah. Dr. Ashwani, I have a query for you also.
Yes, sir.
How to prepare for the prelims exams also? I mean, somebody has also asked this question.
Prelim exam, sir? I mean, you're talking about the exams of MBBS itself?
Basically, भूल जाओ PG entrance exam. First year में है, अभी तो मेरा स्टेज आ रहा है, अपर लिम आना है उसके अंदर सिर्फ, और मेरे को तो ये याद ही नहीं हो रहा कि एक्सिलरी आर्टरी की 6 ब्रांचेस कौन सी होती हैं.
This is the precise reason that we have these concept videos for. This is the only thing I would say, probably the most important thing which separates us from the other available platform, because we are the only platform which have recorded these lectures, keeping that in mind that a student has to appear for the practical exam, the vivavos, the theory exam, how to draw, how to write. I'm sure that the people who watched my lecture, they know that I keep telling that how to draw the diagram, how to keep it in a presentation in front of the faculty, diagram pehle banana hai, baad mein banana hai, histo picture kaise banane, like we keep on guiding for all these things here. So this prelim exam query wala jo aayi hai yahan pe, this is absolutely something that is there in between the lectures, and I probably मेरे हर lecture में शायद आपको मिलेगा. I keep telling that if a question is asked on this as a short note, as a long note, what clinical you need to write about, how to represent it, so it's there. So वो तो हमारा सबसे primary goal है in lectures के अंदर कि obviously we have to take care of your first year MBBS. So Mr. Nerd, I'm sorry, I have to call you with your name itself. So if you just go and watch any video, any topic which I'm sure is available to you on eGurukul, and you'll find out कि उसमें आपको अपना पता चल जाएगा कि how to attend the lectures, how to attend the exam.
All
yes,
right.
You
have another question?
Kishan, you said histology is also a big challenge of anatomy, but histology is one part which I did not teach in eGurukul last year, but histology is something which I'm currently recording for the first year. So entire histology will be done by me itself. Every single topic of histology will be covered, and I'm saying it live in front of you that histology is already under recording. जब तक आप histo तक पहुंचेंगे, like in your college, like the moment you reach the systemic histology, already the entire histology will be there. So no worry, histology is like my responsibility. Don't worry.
Dr. Ashwani, another question for you. Is there any notes or books by eGurukul easy language for university exams?
Sir, what as you rightly said, अगर आप अपने notes खुद बनाओगे तो that is the best thing. I know no matter how much we keep on pushing this thing, people keep on asking for the notes over and over again. But we are in the process of getting the notes made from the concept videos. Despite those notes will be available to you in after some time, but फिर भी I'm sure और सर भी ये बोलेंगे यार अगर आप अपने notes खुद बनाओगे तो there's nothing like that here. And already if you are in the Telegram group of the e-Gurukul First Prof, then you'll find there are so many PDFs which I've already shared there in it about the upper limb, lower limb, the topics which are going on in your college, and they are also that how to attempt the answers in that. It's already there. You can just go and check that out.
I think we have addressed majority of the queries, boss. So that's all, guys. Just for the brief, those who have joined the channel late, the DBMCI has as an app by the name of eGurukul, and eGurukul has concept videos for the first year and the second year MBBS student, which is different from the PG videos which has been given by all other places. These are detailed videos for the subject, where the subject is taught at length, taking care of your prof as well as your understanding or the detailed understanding, which you can learn, enjoy the subject with your normal MBBS. Along with that, you also have the concept QBank, where as per the videos, you're going to get the question. One of the biggest challenge in the last few years with the Gurukul was the challenges with the question bank. However, we all as teachers have worked very, very hard on the QBank, and I'm very, very hopeful and very, very certain that in the 4.0, you will not see any challenge related to the QBank, and rather it will be the most to the point, updated, next ready QBank that is needed for the exams. So that's all from our side. Thank you very much for sparing your time to join us. Do let us know if we can help you out in any form. Please remember the Guru Month. The books are the best friend. If you can read it from the books, if you can make your own schedule, nothing can be better than that. That's the best thing. However, if you think you need a guide, you need a support, we will try our level best to provide you that helping hand that you're looking for. That's all from my side. Thank you very much, guys. And boss, it has been an amazing talk with you, and hope to have more sessions for the first year students soon.
Pleasure is utterly mine, sir. Thank you so much. Thank you, everyone. And if you have any query related to anything, you can, first of all, you just fill up that Google form, which is made available to you. And you can also put the comments under the video when it is posted there. We'll make sure that we'll read the comments, and I'll make sure that I'll reply you in your comment section here. So thank you for attending the session. Thank you so much, sir, for sparing time.
Thank you. Thank you, boss.